There's serious concern tonight about an ingredient in certain prescription drugs used to treat epilepsy, bipolar disorders, and migraine headaches. It's called valproic acid, and when pregnant women take it, there's an increased risk of birth defects. Some doctors know this, and most patients don't. Here's CTV's medical specialist Avis Favaro on a serious information gap.
Hey, Savannah.
For the first 2 years of her life, Savannah couldn't smile, was slow to walk and talk.
She didn't really move much. She couldn't even move like most of her one side of her body.
She has fetal valproate syndrome, a developmental disorder that was likely caused by valproic acid. It's in medications that her mother, Nicole, uses to control her epilepsy. But she didn't know the drug might harm her child.
It's hard to deal with, I wish that she didn't have it.
At no time, says Vale, was she warned by doctors it was linked to birth defects and lowered IQ. Noreen Spagnol also takes valproic acid for epilepsy. She has 2 daughters, both affected. We were asked not to show them. And she's angry her doctor didn't warn her.
He didn't tell me, do you want to try another medication? Do you want to look more into what the side effects are? He didn't give me any of those options.
Doctors admit they don't know how many babies are being born affected in Canada, but it's become such a problem in parts of the world that countries like France and the UK have recently issued strong warnings that valproic acid should not be prescribed to women of childbearing potential or only as a last resort. Health Canada posted this advisory online 5 years ago, but patient advocates say the information clearly isn't reaching those on the front lines.
So it is a significant concern that not just neurologists but also all doctors who are prescribing these medications do need to be aware of this.
Discontinuing this drug is also a tough choice because substitute medications may just not work, and a seizure during pregnancy can carry the risk of death for both mother and baby.
Each one's special in their own way.
Making the decision to use drugs with valproic acid one that must be done carefully for both mother and child. Avis Favaro, CTV News, Toronto.